Welcome to our webinar about scalp micropigmentation. We've got Dr. Jeffrey Epstein and Jose Armas. I'm going to let Dr. Jeffrey Epstein take it over and introduce Jose for us.
Well, hi, everyone. Good evening. Thank you, Stacy, for helping make this happen. And Jose, thank you for giving up your Friday night with your two young kids and wife and being here to help us do this webinar. We've received a lot of interest, particularly about the webinar, but also over the last several years as we've been offering scalp micropigmentation, which I'm going to let you talk about quite a bit, Jose. But basically, I'm here, everyone. I'm Dr. Jeff Epstein. I'm here to talk a little bit, or basically to introduce Jose, talk a little bit about him and introduce him, and then let him present a variety of cases, as well as to talk about how SMP works, the process, and then finally, he'll be available to answer any questions. I probably will not be staying on the entire webinar. I've got plans with I have to take care of my two young kids, but I do appreciate everyone coming on, and I hope you find it as enjoyable as I as we all hope. Anyway, scalp micropigmentation is a procedure that, as part of the hair restoration armamentarium, has become very popular, particularly over the last 3-4 years, which is around the time we started offering it. We started hearing about SMP around 6 or 7 years ago by a few clinics, mostly non-medical clinics, that were doing SMP to create that shaved head of hair with basically looks like guys just have a complete head of hair, but it's all been shaved. And the concept is, guys, will be able to say, well, be able to give the impression or the image that they're shaving their head not because they're balding, but because they like to just buzz their head. And it's a nice look for some individuals. And when done properly, full scalp SMP can provide a natural look. The SMP that we really focus on is typically either as a self-standing or as a complement to hair restoration surgery or medical therapy. And in these cases, we're mainly using the SMP to reduce the visibility of the scalp, which thus provides a fuller look of a head of hair. I sort of analogize it to when individuals sprinkle on those fibers, but it works a little differently. First of all, SMP is permanent, lasts for 5 years typically, and then starts to fade away, which is a good thing, because as individuals get older and they start becoming more gray, which does happen in the occasional person, they won't be left with a bunch of dark dots on their head. And the other advantage of it being temporary is, after 5 years, they may say, well, I'm not really interested to, keep on having this. It's not as important to me. But SMP, basically, the only difference between that and the fibers is that, number one, it's permanent. So you don't have to apply it every time. You don't have to worry about getting your head wet, getting caught in the rain or waking up in the morning and having to put it on. But the other thing is it doesn't make the hair look fuller. It just reduces the visibility of the bald scalp or the scalp, and thus creates a fuller look that way. For many individuals, particularly those with light scalp and dark hair, where the scalp shows right through, SMP can be very valuable. We particularly like SMP for many of our female patients that just have diffuse thinning, that are looking for a fuller look, and Jose is going to give you some examples of that. The other kind of SMP we really like is particularly for the crown, when guys get some transplant work, but it's usually not enough to create as full a look as what we can achieve in the frontal half of the scalp. And in these cases, SMP can provide a much fuller look. So when we started offering SMP around 3-4 years ago, I sent Jose to get training. He's been with me for a number of years as one of my top hair techs. So he has a real appreciation for the aesthetics of hair restoration, but I sent him to, get training, and he really took to it, and spent a lot of time developing his techniques. And I think he takes a lot of pride, which is most important in any practitioner of aesthetic arts. Takes a lot of pride in what he does, and he works hard and takes good care of our patients. So at this point, Jose, I'm going to let you take it away.
Hey guys, how are you? So going into SMP, I just wanted to show a little quick video on it, and basically goes over the general idea of it. And hi, my name is Jose. I'm the scalp micropigmentation specialist at the office. Just wanted to show a couple before and afters of the last case I did. So we can go over it and essentially give you guys a little bit of information about it. So this is some of the results we're able to achieve with the SMP, where we would cover up the scars and have it look undetectable whenever we have cases like this that need a little bit of camouflaging. As you can appreciate, there's a little bit of scabbing or dandruff that goes on after the sessions, and this is just the very top layer of the skin just being dry and shedding, but it's totally normal. We usually do about 2 to 3 sessions on patients like her, just to we can get some coverage not only on the scar but the surrounding area, so we're able to camouflage it better. So SMPs, in essence, it's a tattoo, a medical grade tattoo with a little bit of a different ink than your natural or common tattoo that you see on your everyday. The reason for this is just to prevent the blue hues or the green hues to come out 5 or 6 years down the road. That's why one of the things why it's semi-permanent and it's not permanent, it shouldn't last you 30 to 40 years. You don't want it as intense 20 years down the road, where you maybe have a little bit of lighter hair, you maybe have a little bit more white, more salt and pepper look. The reasons why we don't use the same ink as your regular tattoo that you see on arms, body, whatnot. Scalp micropigmentation is little micro dots, and it's supposed to mimic hair coming out of the skin. What we can do with this is mimic a shadowing effect on their longer hair, giving 60 to 70% improvement overall on the top of the head. With cases, for most cases, I can achieve this results in about 2 to 3 sessions, usually about 45 minutes to an hour long each. You want to spread it apart about 8 to 10 days between one session and the other. What this does is allows the scalp to heal, and we can go in between the dots we have already done, and we create a layering effect. We can build on top of what's already there, which acts as a base color, and we can see where the patient needs a little bit more density or a little bit less density to make everything as uniform as possible. With the procedure, it be a complement to hair transplant surgery. So most patients usually come in and they have enough for a certain amount or certain areas on the scalp. What we can do with SMP is areas where they did not have enough grafts or areas where they would like a little bit more density, we can add to that as well in one procedure. For example, hair transplant will complement SMP, and SMP can complement a hair transplant where patients can get a little bit of hair transplant on the frontal scalp to mid scalp, and then we do SMP into the crown, where for most patients where they don't have enough amount of grafts. Some of the more common questions we get is, do I need to cut my hair shorter for the SMP? For most patients, you really do not. We deal more with the longer haircuts, the longer hairstyles for most guys due to the nature of the practice. Another question we get from a lot of our patients is, do you take into consideration hair color? Am I a blonde versus brunette? We really do not, because we're trying to mimic a shadowing effect under the hair more than trying to mimic the hair itself. So it will work for redheads, it will work for blondes, platinum blondes, dark hair. So if you ever down the road decide to change your hair or make it shorter, you get more praise, etc. It should work and should look natural throughout the course of its life. Thank you guys for all the questions and logging in. You guys can inquire online or call the office, and because you guys logged into the webinar, you'll get an extra 15% off until the end of the year.
Nice job, Jose.
Thank you. So going into it, yeah.
I was thinking perhaps there's some people that have some questions or anything you'd like to add. I mean, it was a nice basic presentation. I'm proud of you. You know, fortunately, we don't rely on webinars to keep you busy. You certainly have enough of your own patients, but I appreciate you putting in the effort to, you know, to help educate others. But I don't know if there's anyone that would like to ask a question. I think you know, we don't have a lot of participants, so certainly there's an opportunity for people to hold up your hand and ask a question. I think Francis, let me see, Stacy, could we maybe get, I see there's someone holding his hand up.
Yes, let me allow Francis. Francis was in our webinar yesterday.
Cool.
Hey, Francis, what kind of question can we answer for you today?
Dr. Epstein. Actually, I joined 5 minutes late, and I heard you were mentioning something about some of the procedure or the earlier one that was earlier to SMP method. May I know about that? Because I joined late. I did not listen completely.
So the first initial forms of SMP
I think so. What he was detailing, right in the beginning.
yes, we were going into how SMP or the buzz cut look, and that was working for a lot of patients that weren't candidates for the hair transplants back then. And he was doing that job of creating the illusion that they had a little bit of hair going on through the top, and it was covered. They were getting good results of covering scars and whatnot. But due to the nature of the practice, we've been seeing more of the longer hair and just complementing hair transplants and having patients really not have to trim their hair shorter.
So the previous method requires cutting the hair short.
Yeah, most artists back then, or still to this day, some artists prefer that method, and it's essentially shaving your scalp down to a zero or no guard on the clippers, and essentially you have the same haircut every single day.
Okay, so even if I have a long fuller hair, I can just come for SMP without cutting anything.
Yeah, most patients can range it from a 1 on the clippers to a 7 or an 8, or have really long hairs like female patients. So there's no limitations on haircuts.
One thing I'm failing to understand is, like from the pictures, it looks like the crown area where the bald is seen. It looks like the hair. I mean, it is in sync. It is as same as other areas of the hair. How is it possible? Because you were saying it's like something like a tattoo that's going to be applied, but it looks like some hair was put in that area. So how do you make that possible?
How do I achieve the center of the crown to look at surrounding areas is what you're asking?
Yes, compared to the surrounding areas, it looks like uniform to the other areas.
Yes, and that's really where the art of this portion of SMP comes in. It's trying to mimic or have a uniformity throughout the top of the head, and the way for most guys that achieve this is not concentrating as much in the very center of the scalp, the problem area, for example, the crown. It's more so reinforcing the outer, perimeter of the crown, and essentially making it look like it's about half the size it is. Once you sprinkle a little bit in the center, it gives you that illusion that it's almost completely filled in.
Okay.
That was a good question.
Yeah, because when you said tattoo, I was imagining like, okay, if the tattoo is applied, like it will still look like something like it'll be hollow in that portion with the black mark, and the other areas will look with hair. So I was it was difficult for me to understand.
Yeah, and it's a layering effect as well. So you go heavier on some areas, for example, the lighter areas, and then a little bit lighter on the fuller or more hair, where you
Right.
have more concentration of hair. So again, the key word here is uniformity as much as possible.
So that being said, you don't apply any temporary hair like that, right? Nothing like placing some hair on the missing areas, right? On
No
the
hairs fixed on the area. No glue,
okay,
nothing like that.
okay, thanks.
So strictly SMP.
Okay. And you said like the tattoo or the black mark will hold good for 5 years. Can I request a thicker tattoo which can last for 10 years?
So on most guys, depending on obviously sun exposure, their skin type and whatnot, you can
Uh,
get, we usually say 5 years, but we've seen guys as far out as 8 years, and they have been doing just fine with their SMP. With SMP, since it's semi-permanent or it's a tattoo, you essentially don't need it as intense 8 years down the road. If at the 8 year mark, at the 5 year mark, you feel like it's not doing enough, what we have most guys do at that point is have them come back and we do a touch up, and it essentially brings everything back to where it was from essentially day one.
so how long can I redo this in my throughout my life? Like how
Throughout
many
your life,
times?
you can do it a couple of times, you can do it multiple times, basically until you're 80, 90 years old.
Okay. So there is no level of ink, right? Which makes it deeper or darker, nothing like that. It's the same level of whatever tattoo you're applying.
So there's variations, not only variations on the dot size,
Mhm.
and that will determine if it looks a little bit darker or a little bit lighter. Also, I can have variations of the color of the ink itself. So it's variations or shades of gray. It goes from a very dark gray to a very light gray. And
Okay.
also how spaced apart or how far apart or tightly the dots are placed. So all basically the combo of everything will give you, that variation and the layering effect and the illusion that it's thicker some places and lighter in some other places. So it's little things or little tricks that we use to essentially get it to where we want to.
So that totally depends on my hair nature and my hair color. So accordingly, you will adjust, right?
Yeah, and it's essentially also taking into consideration your scalp color as well, and the hair length and what's going on as far as hair loss as well. That's what we do. I believe that's why we achieve great results as well, because we not only are doing SMP, but we're combining it with medical therapy from the office, and we're essentially long-term solution for the patients.
So maximum, you said 2 or 3 treatments is needed to get a fuller thing.
Most
Depends on
guys,
the person.
I see them on average about 3 times, and
Okay.
session being between 30 minutes to an hour long each. The first session, I usually try to cut it a little bit shorter just to determine what the color will heal like on that patient, and then we do the bulk of the work on the following sessions.
And it differs from person to person, right? How many treatments are needed?
Come again?
It differs from person to person, how many treatments are
Yes,
needed.
there's guys that will take the ink very, very well within 1 or 2 sessions and retain most of the color. Some guys, again, due to their skin type, would kind of have the ink fade a little bit faster. So we usually take it by patient.
And they are spaced 10 days apart, you said?
Each session's about 8 to 10 days apart. Correct.
Okay. So after SMP, do my combing style will differ or still can I continue combing the same way as I do now?
Combing?
Uh-huh.
Yes, you can comb. You have zero restrictions with combing your hair with hair products. The only thing we do ask of patients is for them not to get under the shower head for 3 days to 5 days after the session. And this is to prevent the ink as it's healing to dilute. But as far as any other restrictions, there's no restrictions. There you can work out, you can get in the sauna, pretty much anything except, again, getting under the shower head and obviously submerging your head on the water like in a pool or at the beach.
But that's only for a few days, right?
Only for the day 3 to day 5 after the session.
Okay, after day 5, I'm free to
You're good to go.
use water.
You can do
Okay,
whatever. Those are
okay.
all very valid questions.
So now I'm using minoxidil, which is the foam that I'm applying on the crown.
Yes.
So I'm thinking of using it for 6 months, see how it gets improved, and then thinking of doing SMP. Will that work?
Yes. So with
Okay.
minoxidil, we are noticing, and again, we're one of the very few that are using medical therapy with SMP in combination. So with minoxidil, we're noticing that if you use minoxidil closer to the sessions, so basically you don't give yourself about a week without using minoxidil, we're noticing that the color doesn't take as strong, or it fades a little bit too much than what we want it to. We've been noticing that the last year or so, I've just been documenting guys that do minoxidil, and then it takes them 1 or 2 extra sessions just to get to where we want to, just because they're using Rogaine.
So it's better to stop it before the SMP
I usually
treatment?
tell guys the 3 to 5 days that you're waiting for no water on the head, just at least those 3 to 5 days, try to stay away from the minoxidil.
Okay, thank you.
Pleasure. Let me see if there's something.
I think there's another question from Nick.
Yes. Okay. Can you hear me? Yeah.
Yes.
Okay, great. Hi, how are you? Hey, Dr. Epstein, how are you doing? You
Nick.
both have worked on my head to add some transplants in, so thank you very much. A question I had is for me, and then also I'm going to ask for my wife. So for me, I've noticed that in the front I'm starting to thin a little bit, and I was trying to decide whether I was going to come back in to see if we could do some more, add some more hair in there. But if you were to try the SMP in the interim, can you still get the hair transplant in that area, or?
So yes,
Uh,
hair transplant and SMP do not interfere with one another. That's why we've been using it a lot in the office. You can do SMP, and as soon as 10 days later, you can come back and get a hair transplant into the same area, and the hairs will not be affected by the SMP in any shape or form. Same thing if you do a hair transplant first. We usually like to give it a little bit more just because you're going to have inflammation and tenderness. So we usually, after the hair transplant, give it about a good month or so. Then you can come back and start your SMP process. But yes, they do not affect one another.
Okay. And then in regards for my wife, she wasn't able to attend. She had a engagement. She had asked, she has lupus, and one of the things is it attacked her scalp. So she's been losing hair, and it's kind of like patchy. So she was trying to figure out an alternative. And is SMP good for, you know, somebody who has lupus and has an issue with the scalp?
Doc, I usually would try to go to doc and one of the nurse practitioners in the office, see if everything is stable or, not safe for me to proceed. Then we usually, yes, we can treat some patients, but it's not, I don't get them every day.
Yeah, in general, lupus is not a contraindication. If it's controlled, if it's stable, if it's not a contraindication to getting SMP. In fact, it could be a good indication. We would first have the her immunologist or rheumatologist clear her for the procedure, but it shouldn't be a problem.
Okay. All right, great. Thank you very much. It was good seeing you both.
You got it, Nick. You too. Nice to hear from you.
And go ahead, Francis, you're cleared to talk.
Okay, one thing I forgot to ask. You said about like the hair transplant and the SMP doesn't interfere with each other unless you have a couple of days gap in between. But
Yeah.
how about using the hat? I mean, can I use the hat before the SMP treatment or after the SMP treatment? How far that would be effective? because hat is meant for the hair restoration, right? If I'm not wrong. So how that will help in conjunction with the SMP treatment if I do after the SMP one?
The correct?
Sorry, I don't hear you. There was a break.
Sorry, you were referring to the laser light hat?
Laser, exactly. Laser hat. Yeah.
So again, with the laser light hat, we have patients and we have patients skip about 5 days or so after the SMP session, just so there's nothing affecting the dot itself. So obviously laser light hat is it's a form of light, so you don't want that light hitting the dot within the next 5 days or so after the session, so it doesn't affect it. Since everything in conjunction is fairly new, we don't know if it's gonna affect it or how much is gonna affect it, so we want to make sure that we're doing everything right for our patients and not having, you know, the scalp bombarded with a bunch of treatments at the same time.
But okay, but that 5 days I can understand. But after 5 days, is it good to continue the hat? Is it not going to affect the dots anyway?
It should not. As of right
It
now,
should.
we have not seen any patient being affected with the laser light therapy.
Okay. So regardless of whatever, we have so many things, right? We have the pills, minoxidil, then the laser light, and there's also another like blood down. What is that? I don't understand. I don't know the treatment name that you have. PRP or something,
Yes, PRP,
right? So
the
none of these are going to affect the SMP if I'm going to do SMP with either of these methods, apart from leaving some number of days gap in between. Am I right?
Yep. So with most patients in the office or most treatments in the office that we treat in the office, that conjunction of medical therapy and SMP, we have been doing just fine with them and having zero issues with them as of right now. We haven't had a patient come back and tell me, hey, Jose, you know, this is not taking because I'm doing PRP or whatnot. Again, we're spacing them out in between one procedure and the next, just to make sure that we're not bombarding the scalp with a whole bunch of treatments and trauma and inflammation. But as long as we give those 5 to 10 days between sessions and whatnot, we're doing just fine. We haven't seen
I can continue with the other methods even after the SMP.
even after the SMP. Yeah, once the SMP is we're done with the sessions, you can spend 2-3 years, 5 years, you know, limited amount of time doing either Rogaine or laser light therapy, and you should have zero issues with it. I haven't seen anyone back complaining about, you know, the dots being affected by any other form of medical therapy.
Okay. Thanks.
Pleasure. And
Excellent. Any other questions for Jose? Okay, excellent. Jose, anything you wanted to close with before we sign off? I think you mentioned there is a potential discount for patients who decide if they want to move forward with their SMP, they can contact you and receive a discount off of their procedure.
Correct. So we're offering 15% until the end of the year. This is for anyone that logged in or attended or is interested in SMP until the end of the year. And it essentially will cover for all sessions necessary.
Great. Well, thanks everyone for signing on tonight. We hope you have a great weekend. And if you have any questions, please feel free to reach out to us.